Good morning. Welcome to Viewpoint. I'm Pat Lawson-Muse. Getting a breast cancer diagnosis is undoubtedly one of the most frightening experiences a woman can have. October is Breast Cancer Awareness Month. This morning, we're going to focus on awareness and prevention. My guests are Ann Alexis Hamilton, a breast cancer survivor from Prince William County. She's a member of the National Coalition of 100 Black Women, which is working on the triple-negative breast cancer project. Flavia Walton, PhD with the Prince George's County chapter of the Lynx Incorporated, and Negar Golesorkhi, who is a breast surgical oncologist with Sentara, Northern Virginia. Thank you all for being with us this morning. Ann, I'd like to start with you. If you'll tell me about triple-negative breast cancer, what is that?
Well, that's a great question. Triple-negative breast cancer is a very aggressive cancer, and it's commonly found in minority women, Black and Hispanic women. It is treatable if it's caught early, and we really do recommend a mammogram is the best way to diagnose any sort of breast cancer.
And the project, the triple-negative breast cancer project?
And the project, we're very excited about it. We received a grant from the Potomac Health Foundation, and it's a faith-based program. So we're working partner with 8 churches and Sentara, Northern Virginia Medical Center, and several community leaders to get out into the community. It's a 2-hour program which will be launched on November 2nd.
Dr. Golesorkhi, how does triple-negative breast cancer differ from other forms of cancer, breast cancer?
The difference is in the treatment and prognosis. Once diagnosed with triple-negative breast cancer, our current knowledge dictates that the patient must get chemotherapy. And the prognosis is not as good as estrogen-positive types of breast cancer. However, all types of breast cancers can be treated, and if caught early.
And the estrogen positive or the estrogen related cancers are the more common?
That's correct.
So who are the women being struck most often with triple negative?
Studies have shown it is actually in minority women, particularly in African American women, and that's why it's so important to really let women know how to go about doing breast cancer screening.
Flavia, you are working with a group of women who understand that breast cancer is a problem, but in the African American community, African American women tend to shy away from the doctor. They don't really want to hear about diagnoses, and these are serious risk factors. They complicate the problem.
Absolutely. Early detection is the best prevention and also leads to more successful treatment outcomes. So our intent with our programs through kind of a fun but very intimate setting, we're doing different girls' nights out. And we recently had one on breast cancer, pretty much from the first diagnosis or discovery of a lump on through the treatment cycle and thereafter. And women were really excited about hearing the information. Many have received information, but not as specific or as personalized. And we feel that that's really a key to individuals really internalizing the information and acting on it.
And you are a survivor, we mentioned. How did you find out you had cancer?
Through my own self-awareness. I was very advocate into breast health, taking my own self-breast examinations and also receiving a mammogram. And that's how I found out the very first time. I am a 2-time cancer survivor, and it's from a mammogram that really helped me to locate and diagnose the first time.
So what was your reaction? Your very first reaction when you found out?
It is devastating. You go through a period of fear initially, fear, anger, depression, and why me? But knowing that, you know, you have to get up and you have to fight. And so I realized after being depressed for a few weeks that you really, you know, and finding a good doctor I think is really important, finding good help, just resources are out there, and getting up and saying, you know, this is a fight, so I have to fight. And so finding the positive and fighting this fight is what I think is so important.
Okay, we've got to take a break. We'll continue talking about breast cancer awareness and prevention when we come back. Welcome back. We're talking about breast cancer. And Dr. Golesorkhi, what are the biggest risk factors and the ones that we don't know about but that are big risk factors? We know if you're a woman, obviously you're at higher risk. The older you are, the greater your risk. But what about, for example, menopause?
Postmenopausal women, as long as you are within a normal weight limit. I think obesity is more of an issue than being premenopausal or postmenopausal. So being healthy and having an appropriate weight and being active, those are positive factors. So obesity is a negative factor, not so much postmenopausal. There was some discussion about hormone replacement therapy, and years ago, particularly in the 80s, there was a surge to forego hormone replacement therapy and go on estrogen-based hormone replacement, and that has been shown to be of a lower risk associated with breast cancer.
And what are the differences between breast cancers that develop before menopause versus after?
It appears that the breast cancers before menopause, particularly in younger women, are a bit more aggressive than the ones that occur in postmenopausal. Nevertheless, there's no age limit as to when you should stop getting your mammogram. Just because you're postmenopausal, you are not at a decreased risk. If anything, you're older, so you're at an increased risk. So you should continue getting your mammogram. There's really no deadline.
Flavia, a lot of black women don't want to get mammograms. A lot of women, period, don't like mammograms.
Exactly.
They find them uncomfortable?
They're uncomfortable. They're afraid of what it might tell them. There are also stigmas sometimes that operate still in our community. A stigma attached to cancer, period. Fortunately, we're becoming more enlightened, more informed, so that's starting to dissipate considerably. However, there's still sometimes a stigma that cancer makes you a bad person. And we're really, really working to totally eliminate that stigma so that people will go and really become empowered and become advocates for their own health. Access is a big, big problem as well. Many women don't have mammograms because they lack the insurance coverage. So we're excited about the possibilities from the Affordable Care Act and what that's going to do to really allow women and men to get the kinds of preventive care that they need.
Because although women are more likely to get breast cancer than men do get it.
Absolutely. 1% of all the breast cancers diagnosed are actually in men.
Anne, how much did you know about breast cancer before your diagnosis?
Not much. It was a learning process when I was diagnosed. And so I really had to learn a lot. And the second time I was a little bit more prepared because of my first experience. So I am a 2-time breast cancer survivor and was able to find some things that worked for me was really working with great doctors, feeling comfortable with your doctor, and knowing that the technology is changing and it's so much more, how should I say, it's so much more friendly because of the ways in which hospitals and doctors are working now as teams.
Mm-hmm. Talk about that, Dr. Golesorkhi, the changing technology. How's it changing and how are the changes helping?
In the breast cancer world screening, we have added the 3D tomosynthesis, which is a 3-dimensional mammogram. The data currently does report that it has helped increase detection of smaller cancers that may have been missed by plain mammogram. In addition to that, it has decreased the number of callbacks that women get after getting a screening mammogram. By callback meaning you go home, you think everything is okay, and you get a phone call, please come back for an additional mammogram. So that's in the screening world. In the surgical world, we used to be more aggressive with the cancer surgery. We used to remove the entire breast, the muscle, and all the lymph nodes, and it was very deforming. So research has shown that a lot of times you could have a smaller operation and just 1 or 2 lymph nodes removed, and the survival is the same as long as you get the proper treatment after surgery. In the radiation world, times are changing as well. We used to go from 6 weeks of radiation to 2 weeks, to 5 days of radiation, to now offering it 1 dose during surgery. So times are changing, and obviously our chemotherapy drugs are getting better and better. And the use of anti-estrogen medications are helping cancer survivors battle recurrence.
And are those drugs also, or the hormone treatments, helping to fight the more aggressive or advanced cases of cancer, metastatic cancer, for example?
Yes, there are some medications that are currently being used in treatment of metastatic breast cancer. It's an evolving field. Luckily, we know a lot about breast cancer, and the message out there is let's get it diagnosed early so you have better treatment options and better survival. For metastatic breast cancer survivors, also there is hope. We're working every day to improve technology, medication, chemotherapy.
All right, we're talking about breast cancer. October is Breast Cancer Awareness Month. We'll continue our talk right after this. Her taking care of her husband who had bladder cancer, and after a years-long battle, he died. And then she was diagnosed with cancer. She panicked, I thought. She went immediately and had both of her breasts removed. And she's in her early 30s. And I know that there are a lot of women doing that. Right. But are they doing it unnecessarily? If you're told that you have an aggressive Welcome back. We're talking about breast cancer, and Anne, you were diagnosed twice. After the first time you were treated, and then part of your treatment involved a mastectomy. How did you feel about that, and how did you come to that decision?
It was a decision that my husband and I made. I really thought it was not a very severe cancer, it was not a very aggressive cancer, but I chose to remove my breast because I really wanted to get rid of it. That was my whole thought. Yes, to remove
to get rid of the cancer.
To get rid of the cancer.
Because you thought that would do it.
I thought that would do it, yes.
And it didn't.
And it didn't. It came back.
Dr. Golesorkhi, there are many women, more women these days, who are choosing just to have both breasts removed when they find out they have cancer, or if they find out they have an aggressive form of cancer, or if there was cancer in the family and they feel, I know how this is going to turn out. Yes. What are your thoughts about that, and how do you advise women?
It's very true. Research has shown that more and more women are opting to have bilateral or double mastectomies and remove both breasts, even for stage 1 breast cancer that can be treated with lumpectomy and radiation. Same survival rate. So it has no bearing on your survival. And I try to stress that to my patients, that removing your breast does not, number one, guarantee that you'll never ever get breast cancer again. It does decrease your risk, but it does not make it a 100% guarantee. And the second point to always point out to patients is that it doesn't have an effect on your survival. Whether you live to be 95 and healthy with or without your breast makes absolutely no difference. As long as you have the appropriate surgery and the post-surgical care, you should be all right. In certain populations, we do advocate it, and those are people who carry the BRCA gene mutation. In those women, the risk of developing a new cancer is much higher than even the average population that may have cancer. So recommendation for those women is to actually have prophylactic mastectomy, meaning remove the breast that doesn't have cancer in addition to the breast that does have the cancer. Having said that, a lot of women choose, even with a BRCA gene, not to do that. And that's okay, as long as they have the proper follow-ups.
Flavia, having breast removal is a very a difficult topic for any woman. In the African American community, it is even more so, isn't it?
It appears to be that way. I think that because of just the daily kinds of challenges that we have, it just adds another layer. So it becomes a part of our whole self-esteem, it's who we are, and we can't separate ourselves from the breast. However, conversation is becoming more and more open, and I think opportunities like the Girls' Nights Out that we're having, like the 100 Black Women's a program that they're doing, and many other programs like this within the community that are delivered by people in the community who are trusted within the community, really are helping dissipate a lot of these myths, and a lot of things are starting to happen now that will make women go see about their health, take charge of their health, and become healthier, and in turn just really, really improve the health of our communities.
And what are some of the myths?
Well, some of the myths are the whole disfigurement. It's going to take away your womanhood. You know, you're not going to be pleasing to anyone anymore, and
you can't function sexually.
Mm-hmm. You know, all those kinds of things are attached. And, you know, we have to really take a look at what breasts mean in the society as in general. Breasts have become very sexualized, and that was really not the intent of breasts from the beginning. That was not why they're there, and I think the doctor will agree with that. And not to discourage the sexuality piece of it, but I think that had become probably the first and foremost perception of breast, and we're still trying to get past that in a lot of ways, in a lot of sectors in society.
Dr. Golesorkhi, there are also myths regarding mammograms, which is, you've pointed out, the best diagnostic tool. But a lot of women just absolutely refuse to, or are afraid of getting mammograms.
Right. Some of the fears come from having it being painful, and honestly, it's only a couple minutes. And it can save your life.
Does it hurt some women more than others? Or?
Yes, it actually does. Women who have dense breast tissue, that means there's more tissue to their breast, and therefore the compression of the two paddles is a little bit more. Fatty replaced breast tissue, that means the breast component is basically all fat, is very easy to read through, so the paddle is not going to compress as much, is not going to be as painful. So usually in the younger population, more dense breast tissue, and one of those categories is actually African American women have a lot more density in their breast than other races, it is painful, but it only lasts a couple minutes. And I think if you look at the risks and benefit ratio, you'll see that you can save your life if you have this mammogram. Why not do it? It's just a couple minutes of discomfort. The other fear is radiation, and honestly, the radiation factor should really be out of the door. Minimal radiation exposure. We tell people all the time that it's equivalent to flying from the East Coast to the West Coast on an airplane. So the risks are minimal, and if it saves lives, you should do it.
All right, and we want to mention that we are putting all of the website addresses for the organizations represented here in our panel this morning on your screen. During this break, you'll see that if you'd like to log on to get more information. And we'll be back to continue our talk right after this. I hear you. Yes.
Like the week of 28. Okay, all right, I'm just making sure.
And I'm off.
That, on Monday, like November the.
I looked at my schedule, you got me working
Here we go. Welcome back. We continue talking about breast cancer. We were just talking about mammograms. But Dr. Golesorkhi, I have to ask you again about the male piece, because 1% of men will get breast cancer. Talk about how it manifests in men and what the symptoms are, and what are the treatments different?
It's actually less than 1%. It's 1% of breast cancers diagnosed that are found in men. Usually men present with a lump in their breast or discomfort. Discharge from their nipple. The treatment is very similar to that of women. The only problem with male breast cancer is, since the screening for breast cancer in men is not as vigilant as it is in women, it presents usually at a later stage. However, the current screening for breast cancer for men is just a physical exam. There's really no recommendation for doing yearly mammogram for men, because it's really very rare.
Let's talk a little about your organizations, Flavia and Ann. The links of Prince George's County, the Prince George's County chapter, and the National Coalition of 100 Black Women. You're working on breast cancer, cancer in general, health in the African American community. What are the other initiatives that you're working on there?
Well, nationally, we're working on a number of health initiatives: childhood obesity, heart health, as well as cancer. And we also do things with diabetes, and many of the local chapters take a look at their communities and decide what kinds of health initiatives need to happen within the local chapters. Within our local chapter, we're taking a look at primary health issues that are prevalent within our communities that impact African Americans significantly more than in other communities. And I mentioned our Nights Out format. We're having girls' nights out, men's nights out, kids' days out, seniors' afternoons out, just so that we can impart information. We are partnering with many of the primary or the largest healthcare providers within Prince George's County, or that provide healthcare to Prince George's County residents. And we're partnering with them to provide these nights out and information seminars or series.
And what about your projects?
Well, the National Coalition of 100 Black Women, we're very involved in health, education, and economic and political empowerment. For the Prince William County chapter, we are working in all those areas, but for, again, the triple-negative breast cancer is one of our big initiatives because of the project and the funding that we received from Potomac Health Foundation. And it's really about, again, getting back into the community and educating Black women and increasing their attitudes and their beliefs and their intentions for mammography screening.
Dr. Golesorkhi, what is it that women need to pay most attention to? Do we need to just stay vigilant about those monthly breast exams, get those mammograms every year? I mean, is that enough?
The American Cancer Society recommends that women over the age of 40 and above, to have a yearly clinical breast examination. That means by a physician, nurse practitioner, or a physician assistant, someone who knows how to do a breast exam on you and they're trained to do it. Monthly self-breast exam is still very important. As
hang the card up in the shower.
Hang the card in the shower. Take a peek at yourself in the mirror. It doesn't have to be some big, drawn out, complicated examination. Just take a peek at yourself in the mirror. Make sure everything looks okay. You're patting yourself dry, make sure there's no lumps or bumps, everything looks normal. If there's any problems, you want to go to your doctor. And the yearly mammogram is still recommended. So far, for someone who does not have a family history and significant other risk factors, that is appropriate.
All right, Dr. Negar Golesorkhi, Flavia Walton, and Ann Alexis Hamilton, thank you all for being with us. And thank you. That's Viewpoint. I'm Pat Lawson Muse. Stay with us. News 4 Today continues. And I'll see you on Monday on News 4 at 4.